Good evening, Carbon County. Thank you for joining us for a community healthcare update featuring Memorial Hospital of Carbon County CEO Ken Harman. In this live event, we are going to be discussing the current state of healthcare services provided by MHCC, as well as touch on some upcoming topics and services. As always, please feel free to leave your questions in the chat, and we will be glad to address them at the end of the presentation in our Q&A segment. With that, welcome Ken Harman.
Well, thank you very much. I'm pleased to be here. We certainly want to thank Higher Ed. They just do an absolutely wonderful job, and we are appreciative of the partnership we have with them and the ability that we have to be able to have different speakers come and talk to the community on different topics. Today we wanted just to share just a few things about what MHCC is doing and where we are. The last 2 years for us, our life has been, focused a lot on COVID. We are grateful to see that the COVID numbers are starting to come down. With Omicron in December and January and early February, we saw some very significant numbers. A lot of individuals testing positive for COVID. We saw upwards of 30, 40, 50 patients a day testing positive in the county. I'm excited to let you know that over the last 2 weeks, we're down to only 113 cases. And so we're seeing the numbers dramatically decrease. What's maybe even more important is that the individuals who were getting Omicron were much less severely sick than some of the previous strains. That doesn't mean that we didn't have some individuals pass away from COVID with Omicron. We unfortunately have seen some pass away, but the vast majority of people have not. From a visitor status at the hospital, for much of January, we were in the red status. We're happy to announce that because of the decreasing number of cases and the decreasing positivity rate as determined by the state, we've been able to take that down to the yellow status. And to be honest, I'm very hopeful in the next week or so that we can go to a green status. What that means is we're allowing visitors to come back into the hospital to be able to see family members. We're limiting them to one at a time unless individuals are at the end of life, and then we will have a little bit more. But we are trying to make sure that we continue to provide a safe environment for taking care of the community and making sure that we provide a safe environment for the staff as well. So COVID right now appears to be decreasing. As a hospital, we still encourage people to, if you're not feeling well, if you're feeling that you may be sick, feel free to go to a provider and get evaluated. Or stay home for a few days. The CDC guidelines for the Omicron and for COVID now is to quarantine for 5 days and to then wear a mask for an additional 5. With the changes that we're seeing in COVID, there are some changes that are occurring in the community as well. Local public health in the state of Wyoming are no longer doing contact tracing on every single case. There still is contact tracing being done at the prison. There's still contact tracing being done at the nursing home and at the hospital to make sure in those congregate settings that we can maintain as safe an environment as possible. But most of the other cases, individuals are encouraging they go to their physician and get treated, and if they think that it is in fact COVID, then they'll recommend that they stay home for just those few days. So my hope is that we're starting to see this decrease, and this decrease will last for quite a while. So probably enough about COVID, something that I'm tired of talking about and you're probably all tired of hearing about. In the hospital, we continue to look at our providers and employees. They really are the most important part of the organization. Our ability to take care of people is based upon the wonderful people that we have providing that care. We continue to add additional providers. In fact, we just were able to bring back Cher Bohr. As many of you know, Cher was in our family practice clinic for a few years. did an absolutely exceptional job of providing care to our patients. She had some family issues and had to leave to deal with those family issues. Those issues are now resolved or resolving themselves, and I've been able to work with her, and she contacted me, and she's coming back. So on March 28th, we will have Cher Bohr available in our family practice clinic here in Rawlins again to see patients. We're excited about that for really two reasons. Number one, when I first got here a couple of years ago, one of the challenges that Memorial Hospital had is we had a turnaround where we had people coming and going. And we really worked hard to stabilize our physicians. And I'm proud to show that we have people that are going to be here for years, that are being here. And one of those who had to leave for some personal reasons, she loved the hospital, she loved the community, and she loved the people she was working with, so she's coming back. We also continue to look at additional providers. In fact, earlier today, I had the opportunity of interviewing two physicians to come and join our emergency room to help be able to take care of people in the emergency room. We'll be having offers going out to them in the next day or so. So we're excited to be able to continue to add providers as the community has needs and as we can afford to do so. We're also looking at a number of other growth opportunities. You've probably heard me talk about the fact that long term, we need to be able to get into a new hospital. The hospital that we're in right now is a wonderful facility that was built and designed to help take care of the community. But there are some infrastructure issues with that hospital. A lot of the pipes in the hospital are old. 50, 60-year-old cast iron pipes, unfortunately, tend to age. And so we've been replacing a number of them. We have last year and in 2020 and in early 2021 replaced most of the heating and air conditioning system in the tower. So we're continuing to look at making sure that we have a good environment to take care of people. But we know that long term that's not going to be our best solution. So on January 4th, I went with a couple of board members to the city of Rawlins for a work session with the city council where we talked a little bit about the future plans. We purchased 7 acres immediately next to the hospital and are looking at that new parcel and the existing parcel as the space that we'll be able to put the new hospital going forward. We believe as a community it's important for us to be able to continue to have a presence on the west end of town, and that as we continue to reinvest, that can maybe be an anchor tenant to help with other economic development for Rawlins as well. But a little bit about what we talked about with the city. In order to be able to effectively have that parcel, we want to be able to merge those two parcels together. And so we're working with the city to have some discussions about vacating a portion of 23rd Street. That's the street that goes between that log cabin clinic and the hospital and goes to that church back there. The commitment the hospital has made and the commitment that the town made was in order for any vacating of that road, we would have to make sure that we provide a new road to be able to provide access. And so we're working with engineers right now and some architects and putting together the plans on what would it cost us and what would be those alternatives to be able to move that road and to be able to then merge those two parcels into one parcel. That's the first step really in the new hospital construction. The second part of that is really looking at what we call space planning or master facility planning. Really looking at what are the services that we really need to continue to have, what is the size of those services, and what are efficiencies we can get by moving things closer together. Example, right now we have nursing in the emergency room on the first floor. We have obstetrics and surgery on the second floor. We have ICU and med-surg on the third floor. We can get some synergies and have a smaller geographic footprint in a new facility if we're able to have them close together. We don't necessarily have to have 2 or 3 or 4 medication rooms, one would work. We don't need to have 2 or 3 clean linen rooms, 1 or 2 will do. And so we're looking to see how can we decrease the footprint while still providing the services that the community needs so that the hospital will be able to be here for the next 50 or 60 years. And so that process of that master facility planning, we're working with an architect firm and they're assisting us in that process. That's going to take a few more months for us to do. And at the conclusion of that master facility plan, as an administrative team, we'll be presenting to the board a couple of different options. Option 1 would be a completely new build facility. Option 2 would be moving the clinical services into a new build, but leaving some of the non-clinical services like administration in the old building and doing some remodel of parts of that. We may tear down some of the old hospital and keep some of it. And the third option is really looking at, do we feel that we just want to do a major remodel on the site and have some smaller construction projects. I think the board is likely looking at the new build or that hybrid approach, so option 1 or option 2. But we need to understand what the cost of that is. New hospital construction is not inexpensive. It costs a lot of money, especially right now in the environment with all the shortages of supplies and things. The commitment that we have been making as an administrative team and as a board is we're looking to be able to do this without going to the taxpayers and asking for more money. We know things are tight for everyone, and we are trying to make sure that we can build this new addition without having additional tax running. In fact, maybe that's a nice little segue for me to talk about where does the hospital get its funds. You know, everyone knows that we're a county hospital, and a lot of people assume that means that we get a lot of tax support. That's not the case. Almost all of the revenue that we get comes from the patient care services that we provide. So we get the reimbursements from Medicare or from Medicaid. We get reimbursements from Blue Cross and from other insurances that people have. That's where about 99% of all of our revenue from operating revenue comes from. We last year did go to the county and we got a couple $100,000 that were approved a number of years back in some capital funds, and they gave us those funds to help with some of the construction projects we're doing. But that was the only money that we received from the county or that we got from taxes. And so we're proud to say that we really are keeping the hospital going, keeping the hospital growing, based on the revenue that we're generating. And so let me tell you just a few things that we're continuing to work on and some of the areas that we're looking for growth. Mental health and depression and suicide are significant issues in Carbon County, as it is in Wyoming and in the country. We've hired and put in a primary care mental health provider into our clinic to be able to assist individuals when they need care, to be able to come into an environment that's safe, an environment that people won't know what you're coming for, and to be able to be seen and to get that help. We're committed to continuing to provide that mental health. We're looking at, do we add some of those services out into Hanna? Do we add some of those services into the Platte Valley? In fact, I've got some meetings even tomorrow with some mental health providers to look and see how do we partner with individuals in the community to assist us in making sure that we're not only here to take care of people when they need an emergency room, we're not only here to take care of people when they need primary care clinics, but we're also here to take care of them when they have those mental health concerns or problems as well. In addition, we've been looking at a lot of other concerns that people in the community have. We have a lot of individuals in the community who are going out of town frequently to receive chemotherapy services and cancer services. We don't have the resources to do everything, but we're looking to partner with some additional individuals in Wyoming, and we're hopeful in the next 2 to 3 months to be able to start doing more chemotherapy services. So individuals won't necessarily have to drive to Casper or to Cheyenne or to Laramie or other places to get those chemotherapy treatments. They'll be able to see the oncologist here. They'll be able to get the chemotherapy here. And so look for us in the next couple of months to announce that. We're finalizing the contracts on that right now, and so we're hopeful to be able to do that announcement. So you're all getting the sneak peek of that a little bit tonight, but cancer services are things that we're looking at. We're continuing to look at chronic care management. How do we help people who have chronic diseases so that they can get the services and care that they need? Whether that's diabetic care or high blood pressure or dialysis. And so we have some solutions for a lot of that, and we're continuing to work with the partners here in Wyoming. We don't have to do everything ourselves, but let's see what we can get to come to Carbon County to assist us in taking care of that. And so over the next few months, we're really working on those areas as well to really make sure that the people here in Carbon County are treated well and have the services without having to travel. And we talked about partnerships. Partnerships are important to us. We as a board and as the executive team and physicians have met and had a lot of conversations about what does the community need and how can we help meet those services. We've done community need assessments where we've gone out and asked community members to give us feedback and input. We have a community steering committee made up a number of individuals in the community who have been giving us advice and counsel as to things that we should be doing differently. And we're making lots of change based on those comments. Some of those changes are things we're hiring for, and some of those changes are partnerships that we're doing. I'll give just 2 examples of those partnerships. One, we talked about this cancer service that's coming up. We're having conversations with a cancer service group here in Wyoming who are going to be able to come here. They're going to bring their provider here. They're going to bring a chemo-certified nurse here. We'll be able to do chemotherapy in the hospital. That's a partnership. We don't have to be able to go out and try to recruit an oncologist. We don't have to try to get all the people trained. We can partner with someone who already has those skills, someone that folks in this community are already going and seeing, and be able to add things. But it's also sometimes us helping others. The Medicine Bow Clinic out in Medicine Bow is an example. A wonderful clinic that was struggling and needed some help. Memorial Hospital of Carbon County did not have to come in and take over the clinic. We've come in and provided some assistance. They had their caregiver leave in September, and we moved one of our caregivers to go over and provide services so the people in Medicine Bow continued to be able to see a provider in their own clinic, in their own community. It worked out so well that we've now had that particular provider move full-time over into the Medicine Bow Clinic. And so we're excited that Carrie Lake is now being able to take care of people there. We're still working very closely with them, but they have a separate board. They're in charge of what's happening there, and we're an advisor to help them. By doing that, we think we're being able to help the people in Medicine Bow have better health care, and then not having to use some of the limited resources that we have in that way. So we don't have to own everything. We don't have to have everything. So we've talked a little bit about COVID. We've talked a little bit about the new hospital and some of the providers we're looking at adding and continuing to add, and some of the growth things that we're looking at. But we also are continuing to focus on specialty services. So let me tell you just a couple of exciting things. We have orthopedic surgery, and it is top-notch. We have 2 orthopedic surgeons. Dr. Andrew Jonason is double fellowship trained. He has 2 fellowships, which are beyond the regular residencies. He is trained in joint surgery, and he's trained in trauma. We also went out and got a superstar in Dr. Allred to be able to come in and to help us with sports medicine. He's also very, very good at all of the other general orthopedic things, but he's a specialist and did a fellowship in orthopedics. So you don't have to drive to Laramie, or you don't have to drive to another area. You can come here and have exceptional services. And the outcomes are really top-notch. I've been looking at the outcomes we have for the orthopedics, and I can tell you I've been referring my friends to them. I'm comfortable with the outcomes. They're having great results. People who were struggling to walk because of pain are now out walking. People who were struggling with their shoulders and their ability to hunt are now able to go out and do some hunting. And so we're seeing some real positive examples of great care close to home. But we're not just focused on Rollins. These specialists that we've been talking about are now starting to go out and see people in the community. Dr. Jonason, who we talked about as orthopedics, has been going out and visiting with seniors at the senior centers. Just this last week, he was over in Hanna at the senior center. Last month, he was in the Platte Valley over in Saratoga having conversations. He's done it in Rollins, and he'll continue to go to other areas. But in addition to going out and just talking and doing lunch and learns with people, we're also starting to have clinic appointments available for these providers in the outlying clinics. Dr. Motley, who's one of our obstetricians this last week, started having clinic out in the Platte Valley. So women who are pregnant don't have to drive to Rollins or don't have to drive to Laramie. They can see their provider in the Platte Valley Clinic, and then they just have to come in when they deliver the baby. We're trying to make sure that healthcare is provided at home. In the month of March and April, you're going to see Dr. Lum and you're going to see Dr. Jonason start going out into Hanna and into Saratoga as well. And so we're bringing the specialists to where people live, because healthcare is about getting the care you need with high quality, really cost-conscious care at home, so that you're not having to take days off while you travel. You're not having to have a family member go with you. You can go in, see someone for an hour or an hour and a half, depending on what you're going to be seen for, here at home. So those are just a few of the things that are going on at MHCC. We're excited about where we're at. I believe the clinical quality, as we're looking at it and tracking the best practices, are really improving. 6 months, a year ago, when I was talking to you, I talked about some of the improvements we were making in billing. I can tell you those improvements have been made. The problems that we had with billing are 99% of the time corrected. On occasion, we're still going to have some errors if we don't have the right address or we get the wrong insurance. But the processes are improving. The people that are working at the hospital care about Carbon County, and I'm proud to say that I'm part of that team. So that's I guess the things that I came prepared to talk about, but I am happy to attempt to answer any of the questions that you have, and if I can't get you a specific answer today, we'll go back to the hospital and get an answer for you and get it to you. So, Ryan, I guess you've got some questions coming in, some questions that you have, so
we have some questions, but still feel free, if you're watching this live here, go ahead and send those questions in and we'll get those answered. I guess starting off, there's been talk that the new constructed hospital building will be strictly for admin. Is this true?
No. My philosophy is administration can be in any space. Administration will not be going into the new construction unless we move everything into it. Likely will be put in one of the older areas that no longer need patient care. The areas that, if we go into the hybrid approach, that's option 2, which is new hospital with patient care in the new space and kind of non-patient care left in the old space, we're talking about inpatient, we're talking about OB, we're talking about lab, imaging, ER, surgery. Those are the things that need to go into the new patient space. Administration, business office, medical records, purchasing, engineering, will certainly stay in the old space unless we completely build a brand new building. And then I can tell you, if that's the case, our square footage doesn't need to be as large as what we have. When I built the new hospital in Meeker, Colorado a number of years ago, people couldn't believe it. They said, "You're the CEO of the hospital and you didn't even build windows for your office." No, we put ours in the last place that was there. We wanted to make sure that we provided the appropriate setting to take care of people. Administration, all we are is support folks to be able to help make sure that our nurses and doctors have the tools they need to. So no, it won't be administration going into a new space. It will be patient care that goes into new spaces.
All right. And then I know you kind of touched on how you didn't want to talk about COVID a whole bunch. We have a few questions as far as that goes.
Sure.
And the first one being, has the hospital lost staff because of the vaccine requirement? And if so, how are staffing shortages being dealt with?
Absolutely. The answer is unfortunately yes. We've lost a couple of individuals, and to be honest, I think we may lose a couple of more. The federal government made a mandate through the Centers for Medicaid and Medicare Services, so CMS. The state of Wyoming, with 23 other states, sued the federal government and got a stay on that order. That stay then went to the Supreme Court, and the Supreme Court ruled that CMS did have the right to impose the vaccine mandate on healthcare for those organizations that are licensed by CMS, of which hospitals are. And so because of that federal mandate and because of that Supreme Court ruling, the board at MHCC looked at it and said, is there any way we can get around this mandate? And unfortunately, the federal government tied our funding to it. And so if we failed to follow the mandate, we would lose all of our Medicare funding, our Medicaid funding, our VA funding, and to be honest, most of our commercial funding. Because like our Blue Cross of Wyoming contract specifies that we have to meet the conditions of participation. And so we would have ceased to be a hospital. If we didn't have the money, we couldn't keep the doors open. And so the board made the decision reluctantly that we had to comply. On February 14th, we had to have a list of all of our employees and our doctors and our volunteers and our vendors, those individuals that are coming into a hospital. We had to have the list and kind of know which of those were vaccinated, which of those were not vaccinated. And out of that group of non-vaccinated people, which one of those qualified or were requesting exemptions. We at the hospital have religious exemptions. We have medical exemptions. We have temporary exemptions for people who have had COVID and need to wait for a little bit until they get shots. And so that whole process that we've gone through, we had a couple of individuals who left during that process and leading up to those dates. And the drop dead date for us is March 15th. On March 15th, individuals who are not vaccinated or who have not been given an exemption will no longer be allowed to work in healthcare. And so we've had, as I said, a couple of people who left, and we're going to have a small handful of other individuals who will make the choice not to stay at the hospital as well. How we've been able to handle that is we're aggressively recruiting. Most of those individuals are not nurses and doctors. They are wonderful employees who are working in other areas of the hospital, equally important to the success of our organization. But we have been able to backfill many of those people. Right now, because of some of that, and to be honest, because there's a nursing shortage that COVID has brought on, we have been going out and getting some travelers. Travelers are individuals who don't live here who will come in and work for 13-week contracts. And so we have a number of traveler contracts that we signed to be able to ensure that we're able to have the staff to take care of our patients. I can tell you, and I've told every one of our employees, I would absolutely much rather keep all of our employees at the organization. But unfortunately, with the mandate and with some individuals feeling strongly that they don't wish to get the vaccine and they don't have a medical or religious reason not to get it, we will end up losing a few people. So.
You kind of touched about the clinic in Saratoga. So there's a question here. Is the new clinic in Saratoga performing the way is this clinic in Saratoga performing the way the board and the administration hoped?
Actually, yeah. I mean, it's doing better than we had projected. When we put together new entities like that, we go to the board and we put together a couple of pieces of a business plan. The first part of it is really looking at the clinical needs. Are we taking care of the patients in Carbon County and providing better patient care? And the second is obviously making sure that we achieve some financial return on investment to make sure that we have the resources within the overall organization to sustain ourselves and to continue to be here and to take care of people. In both cases, the answer is yes. In fact, the month of January, we've had the highest number of patients at any time, and so we're continuing to grow that. Dr. Williams, who is the full-time family practice physician there, is very busy, does a great job of treating people. Because he's busy, we now have Jen Waggy, an absolutely wonderful family nurse practitioner, going there 2 days a week. We have Patty Shue, who everyone in Carbon County knows is an exceptional pediatric provider, going there 1 day a week. We have Bob Keel going there and seeing orthopedic patients, and on occasion seeing a few primary care patients. We have Dr. Motley going there and seeing OB patients. And very shortly, we'll have Dr. Jonason and Dr. Lum going there and seeing patients as well. So yeah, the numbers are really very good. The people in the Platte Valley have trusted us to be able to take care of them, and we're thrilled to be one of the choices out there, and proud for those who have selected us that we're going to continue to provide great care. There are other choices out there, and individuals need to look at and determine who are the providers that they feel comfortable seeing. And we, of course, are happy to take care of those who select MHCC, but we're also equally happy to work with others who might want to go to a different primary care provider out there. We do some specialty services when some of those folks go to other providers. So.
All right, and you kind of mentioned with the providers moving around to the different clinics, are there plans to add more providers to the family practice clinics?
The answer is absolutely. We continue to look at the volume of patients. And because of the growth in the Saratoga clinic and the growth in our availability in the Hannah clinic, we needed to add more providers. That's why we reached out to Cher Bohr. So that is an immediate person to bring in to add more capacity. I can tell you, I've already started having conversations, and I think we'll have another provider joining us in our clinics this coming fall. So we're always looking at, are the providers we have busy? Are there spots that are open, shrinking? And when we get to the point where we're not able to take care of people as quickly as we'd like, that's when we're adding another provider. So absolutely, we added Cher, and we're going to continue to add providers over the next few months and probably over the next few years.
And then I was given the option to sign up for a loan to help pay my medical bill. Is this something that is temporary, or is this a long-term program?
It's a long-term program. We've partnered with a group that's called BHG. I think they've got another name that they go by as well, but we found them as we visited with Commerce Bank here locally and talked to them, and it's one of their partners that they found for us. We're excited. Healthcare is expensive. Costs a lot of money. And individuals sometimes struggle to pay their bills. And so we were able to work with this organization. We have to pay some costs for it. But right now we have a 0% interest rate for those folks who have healthcare bills with us and can't pay it. So they can fill out an application. They still have to sign it, but 0% interest. And we're planning on doing that. In fact, John Smith, myself, had conversations earlier today as we looked at how can we continue to help roll that out. And so we're working. We currently have one financial counselor who works with folks to be able to help them understand the details of this program and other mechanisms in paying their bills and our financial assistance plans. We're happy to write off large portions of the bills for folks who don't have the financial means or don't have insurance, as long as we have some commitments to some of the other payment plans going on. So yeah, that BHG loan program that you referenced in the comment is a long-term plan, one that we continue to have. We believe the 0% interest is an important thing because healthcare is expensive, and if we can spread the cost of that over 4 or 5 years or something, that might be the difference before some people getting a surgery and not. So yeah, we really are very much doing that. I can tell you in the next month or so, you're going to see some announcements coming out. We're getting close to tax season, and we'll be offering some discounts for folks who have bills. If they want to come in and pay off the bill, we'll give them some fairly significant discounts if they want to pay the bill down completely. But most people can't afford to pay the bill down completely, which is why we have some of these loans and the 0% interest loans.
All right, well, I think that's all the comments we have for now, comments and questions. So I just wanted to thank you guys for joining us this evening, and thank you, Ken, for the update. As always, if you have any further questions you would like to ask after the live event has ended, please leave them here in the chat, and we will do our best to have those questions addressed. We would also like to remind you to check out the Memorial Hospital of Carbon County YouTube channel, as you can find our past community updates, provider workshops, and more. So on behalf of Memorial Hospital of Carbon County, thank you, and everyone have a good night.
Good night, all.